Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you for your time to spending here to learn something new today. Today we will discuss about denied EOB in medical billing. So what is denied EOB and how to read denial EOB? What kind of information we see on a denied EOB we will discuss today. Okay guys, before we reading about denied EOB, we will discuss about a small concept, three pieces of healthcare in our medical billing. So generally, what happen, patient, I mean, a member, a policy holder, policy holder is nothing but who is giving, who is paying premiums, I mean, regularly. So the policy who having active policy is known as a member or subscriber. So whenever member or subscriber feeling illness, nothing but he has some diagnosis, I mean, he is not feeling okay. So that is nothing but illness. At the time, the policy holder or subscriber is called as a patient. So because of symptoms of that fever or symptoms of that illness, the symptoms of illness is known as a diagnose or diagnosis codes in our medical terminology. So generally, what happen, patient will consult a doctor to get the treatment based on his diagnosis. So at the time, doctor will give the treatment, but in our medical terminology, the treatment will be coded as a CPT code or ECPIC codes. So this whatever treatment given by the doctor to the patient is known as the CPT codes or procedure codes. So how the service, I mean procedure will given to the doctor to the patient is totally based on the diagnosis of that illness. So here on behalf of doctors team, there is a billing team in our RCM cycle. So this billing team will submit the medical claims to the insurance companies on behalf of doctors. At the time, insurance companies will start the adjudication on that particular claims and they will finalize the claims into the payments to the doctors. Also, they will finalize the claims into the denials. Denial in the sense insurance is not giving the payments to the doctors on a medical claims whatever submitted to the insurance companies. So insurance companies providing the explanation of benefits. EOB is a document, paper, or uh, information on a that particular in a particular paper. So that denied information they will, I mean they means insurance, nothing but insurance is also called as a payer or entity. So this insurance will give the a document, I mean explanation of a benefits, EOBs, to the insurance companies on a paid claims, also on a denied claims. But today in this video we will discuss about denied claims. Nothing but a claim submitted to the insurance companies, but insurance companies not giving the payments to the doctors, and insurance companies process the claim and they finalize the claim into the denial. Nothing but they are concluded the claim as a denial. How we have to know means insurance companies will send denied EOB to the particular doctors, and while we are working as a AR caller, we will see that denied EOB in our particular that doctor's respective PMS system, nothing but practice management system. This is a small concept. Why I'm telling means there are a freshers and the people, I mean for them I want to repeat this process so that they will acknowledge this information. Okay, I given definition what is denied claim. A medical claim that an insurance company has received and processed but refused to pay the benefits to the doctors. So benefits are nothing but payments to the doctors. So they refuse to give the payments to the doctors, nothing but insurance is denied the claim. So while they are denied the claim, they will give the denied reason why they denied the claim. They means insurance companies. Why insurance companies denied the claim? Why they are not giving the payments to the doctors? They will give the reason on a denied EOB. That is the way we have to discuss in next slides. Okay guys, the basic and important formula to read EOB we will discuss. So on denied EOB or paid EOB, you will see this kind of formula. So this kind of things, generally we have to understand that billed amount is nothing but whatever total charge amount on a medical claim is also known as a billed amount is equal to allowed amount plus contractual adjustment. So the billed amount is equal to allowed amount plus contractual adjustment is the basic formula we have to remember, where allowed amount is nothing but is the combination of a paid amount plus patient responsibility, and where patient responsibility is nothing but it is a PR1, PR2 and PR3. PR1 is nothing but deductible amount, PR2 is a co-insurance amount, and PR3 is a copay. So these are the basic formula we have to understand. We will see this kind of information on a EOBs which is given by the insurance companies to the doctors. Okay guys, what kind of basic information we will see on a denied EOB we will discuss now. Before that, denied EOB is a document that provides information about a claim that has been denied by the insurance company. So denied EOB is nothing but a document that provides information why they denied. That kind of information we will see on a denied EOB. So we have to understand that if you are getting denied EOB is nothing but provider paid amount is zero. Nothing but insurance is not giving payment to the doctor. So nothing but they are denied the claim. So why they denied the claim also they will give the explanation. That is what we will have information on a EOB. So generally on denied EOB we have information like check information. So what kind of check or check or EFT information we will see, and also we will see claim information, and we will discuss in next slides completely what is what, but before that we will see what is that information just. So third point I given as a service line information. Nothing but whatever the service is given by the doctor to the patient, that kind of procedure details we will have that information under denied EOB. And also we will see adjustment codes information, nothing but claims adjustment reason codes and remittance advice remark codes. So denial code as well as a remark code we will see on a denied EOBs. See guys, sample denied EOB I provided here, and if possible you can pause this video and you can take screenshot and you will see, and I will explain complete details in a next slide. Okay guys, now we are discussing about the denied EOB check information part. So check information, generally, whenever the claim is denied by the insurance companies, check information is not that much important. Why? Because there is a no payment is given to the doctor. Then why check information should be required? So if claim is paid to doctor at the time, check information is required. For example, how much amount was paid to the doctor, it is a bulk amount or single amount. In that way, what is the check number? In that way we will require this information to the claim paid scenarios, but this is claim denied scenario, denied EOB. But just information I'm telling that from which insurance we get the denied EOB we will see on a check information. and what is the insurance address, and what is the check details we will see. I mean, what is the check number, check amount, all those details we will see on a denied EOB check information part. Okay, now we will discuss about denied, undenied, sample denied EOB claim information part. So claim information, what kind of details we have a denied EOB claim information details means the patient name and insured name, claim ID, nothing but insurance is processed the claim. I mean, they completed their adjudication and they denied the claim. At the time, one number is generated by the insurance company. That insurance generated ID, identification number, is known as a claim ID. That ID you will see on a claim information part. And claim status like processed or denied. So claim status is processed, and for example it is a denied, they will see it is a denied. And claim adjustment codes also you will see, and claim remark scores you will see, and member identification number, patient account number. Patient account number is nothing but while your charge entry demo and charge entry people are there, so your doctor will give that particular information. I mean, charge entry and demo entry people will give the particular account number. One number is generated while they are providing patient details and service details into the system. One number is generated. That number will be unique number, unique to patient, and they will provide to policy holder or patient. That number is account number. So whenever we are giving that account number in a respective PMS system, we will see the patient information and also the service information and doctor information. So everything information we will get in respect to PMS based on account number. So that account number details also you will see on that claim information part. And the rendering provider details. So rendering provider is nothing but who is giving the uh, services to the patient. So supervising doctor. So nothing but specialty specialist who is giving the treatment to the doctor, I mean to the patient. That doctor is known as a rendering doctor. And rendering NPI number. So individual NPIs have their respective NPI number, national provider identification number. That also we will see on a claim information part. And peer claim control number, nothing but ICN number. uh, ICN is nothing but international classification of a number or internal control number. Sorry for that. And patient responsibility, we know that PR1, PR2, PR3. That information also we will see as a claim information part. I mean, patient responsibility reason codes, that PR1, PR2, PR3 will be given based on patient responsibility applied. And the patient group number also we will see on that denied EOB claim information part. Okay, we know that on sample denied EOB we will discussing about service line information part. And denied EOB service line information also nothing but procedure information. So nothing but what kind of treatment is given by the doctor to the patient, and on what based diagnosis, on which date. That kind of information is given on a service line information part. Nothing but what is the date of service. Generally, for example, patient is admitted as a inpatient to the hospital. There is a beginning date and a ending date. So that is what beginning service date, ending service date also provided. And what is that doctor NPI number, and how many units. I mean, for example, how many times the service is given, and how many units. For example, injections are given by the doctor to the patient, how many times 2 injections or 3 injections. In that way units will be calculated. And what kind of procedure code is billed on a CPT, I mean on a medical claim form, or what kind of service procedure is given by the doctor to the patient, that is known as a CPT or procedure code. That is also we will see on a service line details. And what kind of modifier is appended to that particular procedure also we will see on a service line details. What is the billed amount? And nothing but whatever the charge amount uh, given on a medical claim form by the doctor to the patient will be submitted to the insurance is nothing but total charge amount, is also known as a billed amount. That information we will see. And how much amount allowed on your billed amount by the insurance companies to the doctors is known as a allowed amount. That might be based on a fee schedules, fixed fee schedules. They will allow particular amount on a particular services. Based on the service they will allow as per the payer guidelines. So insurance will allow some particular amount is known as the allowed amount. It is a fixed payable amount by the insurance companies to the doctors. And that amount also you can see on a service line information part. And how much patient responsibility is there, nothing but deductible, co-insurance, co-pays. So the allowed and patient responsibility, and the remaining is a contractual adjustment details also you will see. So and if claim is filed in a late, what is the late filing details, I mean amount also you will see. And also provider how much is paid also you will see on a denied EOB. But you have to understand that denied EOBs, the paid amount is always zero. That is why it is called as a denied EOB. And why it is a denied, they will give the denial code, and also they will give the remark code in addition to the denied code. See, in this EOB there is a CO226 is a denied code, and a remark code is N706. And other procedure code is 13101 appended with modifier R3. It is denied as a CO272. How you know, in adjustment codes you will see CO272, it is a denied with the reason CO272, and with remark code N20. And here third CPT 11406. Remember always CPT code is a 5-digit code. And this 11406 example on this on this denied OB I am explaining. This 11406 is there is no modifier appended, and it is a bill amount of $2145.91. I mean $2145.91 is a bill amount, and allowed amount is a zero. Patient responsibility is a zero. Whatever billed amount is given as a adjustment amount. Why? Because insurance is not allowed, in the sense there is a no payment to the doctor, nothing but it is a denied. So denied reason is a CO226 as a adjustment code, and remark code is N706. So this is the way how you will reading EOB. So again I am telling, it is a denied or paid. How you know means you should have to provider paid amount, you have to first check. I am telling to new people, I mean new the people who are very beginning to healthcare domain, they don't know how to read EOB. Generally whenever you open the EOB you will see this kind of information on a denied EOB. At the time your first job is to look at provider paid amount. See here, the provider paid amount for each procedure code is a $0 I mean dollar even. So then first you have to look at provider paid amount, it is a zero. Then you should have to look at allowed amount. Then you should have to look at deductible, coincidence, and copay. Sometimes you know what happened, provider paid amount is zero, but the claim is applied towards deductible. So I think that is also very good analysis. If the claim is applied towards the deductible, that is not a denial, it is processed towards the deductible. So at the time also provider paid amount is zero, but if the patient responsibility and the provider paid amount is zero, nothing but allowed is zero, nothing but it is a denied EOB. In that way, you have to analyze and understand that this is a denied EOB. So here the question is how you can understand it is a denied EOB. How you can read this is a denied EOB. Nothing but your first job is to look at provider paid amount. It is a zero. Okay. The paid amount is zero. And you are looking at deductible coincidence copays. It is a zero. Okay. Then you are verified allowed zero. And you double confirm that okay, this is totally zero, nothing but it is a denial. So then you are looking at what is a denied code. So adjustment code you have to look at, okay, this is the reason, that is why it is a denied. There is any particular remark code is there, they're telling that clearly this is why it is a denied. Additionally, it is giving additional information why they want exactly. That is what remark code. So in that way, you have to analyze and understand the, I mean, reading this denied EOB. Okay, just now we discussed about there is a denied codes and denied EOBs. There are three CPT codes on previous slide and in a provider service line information. So I told that there is a CO 226. Here always remember that CO is a contractual obligations, and CO 226 is a information requested from the billing provider or rendering provider was not provided or not provided timely or provided but it is insufficient or incomplete. At the time they will tell that CO 226. So we have to understand that okay, whatever information insurance is required, we are not submitted in timely, or we are submitted incorrectly, or we are not submitted. In that way we will analyze that why insurance is denied the claim. And other CPT is there. The other CPT is given as a denial code CO to 272. Nothing but coverage or program guidelines were not met. So we have to understand that whatever the services are why not met, we have to call and we have to get that information exactly what kind of services, I mean why they are not met. So uh, there is a remark code N20, nothing but service not payable with other service rendered on the same date. So we have to understand that other service is already rendered on this particular date of services, so that is what we they are not payable. So in that way they will give the remark code based on that adjustment code. And N706 is nothing but missing documentation. So generally they are missing some kind of documentation, so they are clearly telling that in this is why we are giving this denial on a claim. So we have to understand that there is a adjustment codes glossary information why they are denied the claim. You will see by understanding and by seeing this denial codes and remarks codes on a denied EOBs. Okay guys, here I given few examples generally, here CARC is nothing but claim adjustment reason code. So here adjustment code, it is used to explain the reason that why a claim adjustment was made by a insurance. For example, claim is denied with the denied code CO18 means we have to understand duplicate claim. So if claim is denied with the adjustment code CO97, we have to understand that it is a inclusive services. And if the claim is denied CO242 code, we have to understand that an attachment is required to process the claim. I mean to pay to give the payments to the doctors. an attachment is required. Nothing but medical records are required to process and to pay the claim uh, to the doctor. And RARC, nothing but remittance advice remark code, are used to provide additional explanation of an adjustment already described by a claim adjustment reason codes. So nothing but they are telling that whatever denied codes also there, for them these are giving additional explanation why it is denied exactly. So that is what example N706 missing documentation, N4 nothing but missing or incomplete or invalid prior insurance carrier EOB. Generally we will get this N4 from the secondary insurance, but here I am giving basic CARC and RARC codes to understand clearly. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. And guys, if you are new to our channel, if you're not yet subscribed, and if you're watching our videos first time, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every our video as a notifications to your mobile. And again, thank you so much really for your time, and thank you for watching. Have a good health. Bye for now.